Yes, I'm Alex Stevenson. I'm the president of the African Neonatal Association, and I would like to tell you just a little bit about the ANA, mainly because I am very excited to hear about the African Fetal Medicine Network. And I'm very excited and supportive, and I'm hoping that we can move forward together because of obvious reasons. Um, and there are the obvious reasons. We are all in our little silos, although few people, I must say, perinatologists are good at breaking down some of those borders. As a neonatologist interested in global health, we're interested in 2.1 million babies a year who are dying globally, 98% of them in low income settings, 1.1 million of them, so over half in Africa. Um, but the burden is almost identical of stillbirths. And of course, you don't need me to tell you folk about that because you are the champions of reducing stillbirths, which is something that it's a drum that has to be beaten and beaten and beaten. And it's something that we have to keep talking about because these are our babies. And of course, again, it's our our worlds interact around the timing of delivery, the choice of the timing of delivery, the antenatal management, and that perennial question of, is this baby better in or better out? Very interesting to see those statistics from Mumbeni in Dar es Salaam. And yeah, data is the good data is the currency of truth and allows us to make good decisions. So back to the ANA very briefly. We were formally established in 2022. We just had our biannual general meeting on Friday. At the moment, I think we've got 380 members in 40 African countries, and that takes some doing. We've got a registered office and headquarters in Rwanda. We're a trilingual organization. At least we try to be trilingual. So we use English, French, and Portuguese. And I think that's very important when setting up an African organization is to try and include those communities. I can't say that we have had that we have been perfect or even that we have great success, but we have tried, and I'll tell you a bit more about that. We started off being a bilingual organization, and we've done better with our French community. So West Africa has the largest French-speaking population in the world. And what's unusual about that Francophone area is that those people tend only to, their only European language they speak is French. Of course, they'll speak Wolof and many other languages, but the only European language they'll speak is French, unlike France or Belgium or Canada, where almost all professionals will be speaking English. And so our colleagues in West Africa are linguistically isolated. And I've learned even more so in Lusophone Africa, Mozambique, Angola, Guinea-Bissau, Cote d'Ivoire. There's millions, I think about 60 million Portuguese speakers. So that's a lot of people. Anyway, enough about that. We have received two small grants totaling about $20,000 to help us get on our feet. And we are applying for a new ventures grant from Gates for 100,000. And I can tell you that if you're doing good work and your heart is in the right place, I don't think that you will struggle to get money. I can certainly introduce you to people. There is so much support for African professional networks. We There's a bit of a confusion. The African Neonatal Association is a professional organization of professionals where doctors and where neonatologists and pediatricians looking after neonates in Africa. Then we have a project, which is the African Neonatal Network. That is a project that is quality improvement, quality community collaborative. And so that's our project. We've partnered with the Vermont Oxford Network to do that, and that's been funded up to $1.7 million over 3 years. Just telling you, guys, there's money out there. Like, you're doing a great thing. You reach out. I don't think you're going to struggle to get the funding. The struggle that we've had is developing our internal organization capacity and governance to deal with the money. Most of the time, I generally say, no, we don't want that money. We're not ready, which I'll explain to you later. Okay, so this is how we've organized our um, organization. We've sort of gone the x-axis and the y-axis, and we've hoped that we are going to weave a fabric that will make us stronger. So on the x-axis, we've looked at themes, which is education, research, advocacy, and collaboration. So we've got a committee for each of those, and they've been incredibly active and incredibly productive in the last 2 years. Our research tends to we get a lot of people wanting to do little, because we have an amazing network. Everyone wants to do their little survey of blah, blah, blah in your country. And we try and filter it through our research network so that our members aren't constantly bombarded by surveys. Our research committee prioritizes what we think are priorities for research and collaborate. And they've done a lot of important and good collaboration. They've also set up a journal that I'll talk about in a moment. Our advocacy and collaboration committee is amazing and is networking us with many other organizations and getting our voice out there. And our education committee is also doing important work, very exciting work in the world of pediatrics. Well, in the world of medicine in Africa, there is the East, Central, and Southern colleges of whatever you want, be it physicians, surgeons, orthopods, pediatricians, midwives. And so we're participating in getting a standardized neonatal curriculum and authority. And I'm sure there will be the same for fetal medicine. This is our journal, the Journal of African Neonatal Association. It's fully registered both in the British-speaking world, but also with, I think it's called CAMSEC, which is very important for our Francophone colleagues because their professional advancement and their professorial appointments depend on publications in, I think it's CAMSEC or CAMTEC approved journal, which we are. And what I'm really excited to tell you, and I hope you can share with your colleagues, is please, we would be delighted to have papers around perinatology, around fetal medicine. It's just a $50 publication fee, so I think that's quite achievable. There's a quick turnaround. We're quarterly, and we don't have the highest, we're not the New England Journal of Medicine, but we are a proper professional journal, and we would be delighted to publish papers out of Africa. If you forget, just Google the African Neonatal Association, African Neonates, whatever, ask for Dr. Varenga. We can put you in touch, but please consider us. Okay, remember on the x-axis, we had those thematic committees. On the y-axis, we have working groups that look at specific areas, which are on the screen. These are some of the core areas of neonatology, and within then we've got experts and people who are particularly interested in that area who work on that area and interact with the other committees. Okay, a little bit about the network. Remember, I've previously been talking about the African Neonatal Association. Now, the network is our project, well, one of our projects. At the moment, we've got 20 hospitals, 5 countries, Zimbabwe, Rwanda, Uganda, Ethiopia, and Nigeria. We're using a common electronic database, and we're undergoing collaborative quality improvement. We've only just started entering data about 8 weeks ago, but that it's going to be a great way forward because, as we all know, data is critically important. There are two things. So we've just had our first 2 years. We just had, as I said, our annual biannual meeting on Friday. And then the next 2 years, we want to achieve two main things. One is that we want to have a partnership incubator, which is within our field of neonatology. And so we want to, because at the moment, kind of everything comes through Stevenson's head, which is not a good organizational way of running an organization. So we are trying to develop a hub that might be around resuscitation or around nutrition, and then corral African people who are interested in that and people in the global community who are interested in that, who can then get together. I can give an example of our sepsis working group, which is already a step ahead of the others. So they are phenomenally active. They're publishing papers. They are having Zoom meetings and about to have an in-person meeting next month, where we will be discussing the research and implementation priorities and identifying areas for collaboration and cooperation, and developing a strategic plan for the next 5 years. So short term, and remember, like, perfection is the enemy of doing anything. Like, it's just do something and move forward and learn from that. I have to keep telling myself that. Otherwise, you just get stuck in trying to do things perfectly and never actually doing anything. But the other thing that I'm particularly interested in, and which is why I'm so delighted to be able to talk to you, is what was, until last night, called the African Neonatal Umbrella, which we are often criticized as the African Neonatal Association, that we're exclusive, we're just doctors, and there's so many other people and organizations and professions involved looking after babies. And that's very true. It's very true indeed. And we, as neonatologists, would hardly make a dent on anything in Africa. Like, the bulk of the work is going to be done by nurses, by doctors in the community. And so we've developed this umbrella approach, in that we are actively encouraging all our colleagues in Africa some are already organized, like we certainly weren't the first. The pediatric surgeons are already organized. Many of the other professions and groups have networks going. Some we are helping our neonatal nurses, and very importantly, our family representatives and organizations. That's been a very big learning lesson for me, that they are key, crucial. They are the ones who won the HIV fight. It was when the communities organized that things changed, and it will be the same. But hey, it's not neonatal, it's perinatal. And I think the umbrella needs to be called the African Perinatal Umbrella, because the work that going back from contraception to the fetal medicine that you folk are doing, the perinatologists, the midwives, the obstetricians, is absolutely key. And those 1.9 million stillbirths are every bit as important as those 2.1 million neonatal deaths. And so, collaboration, cooperation is the way forward. So some of the lessons that we have learned in the last 2 years, the one which I've been saying over and over, is just start. The African Neonatal Association started as a WhatsApp group, and for 3 years it just was a WhatsApp group. And it, to tell you the truth, predominantly remains a WhatsApp group. And that's fantastic. That's where things happen. That's where people chat. That's where someone says, hey, what's going on here? Or has anyone seen this? Or where can I get a good CPAP? It's great. Um, just start and see where it goes. And the great thing about starting informally with a WhatsApp group and without structures is that you get to know who is active, who is prepared to go the extra mile, who is maybe has the time. I think we're all prepared to go the extra mile, but some of us all of us are burdened by many other responsibilities. But some people have the luxury and ability to put a little more time into these organizations than others. We started in COVID. There were many problems of COVID, but there were many opportunities, and technology is our friend. So, WhatsApp is great for a continental organization. Zoom is great, which you already know. Google Translate is great. Okay. Je ne parle très bien en français, mais avec mon ami Google, je peux parler très, très bien. So, especially on WhatsApp, you can just type what you want in English, go to Google Translate, it can put it into French or Portuguese. It's not perfect, but it's certainly understandable. And it brings the third of Africa that doesn't speak English into the conversation. Money complicates things. Of course, as you grow, you need money. And you're not going to become a large, effective organization without money. But where there's money, there are different motivations. You have to be a whole lot more grown up. There's a whole lot more accountability, and suddenly you find you're spending more and more of your time talking about money rather than talking about neonates. But yeah, I think we all know that. And we all know that there are good partners and less good partners. There are amazing organizations, both within Africa and outside Africa, who are there for the right reason. I think almost all organizations are there for the right reasons. I can't say that there are organizations who are, somehow nefariously and nicodemously against African neonates. Almost everyone is supporting us. But some people come with their own agendas, which I admire because focus drives you forward. But you have to choose, like, is this really, how closely aligned is this with our agenda? Of course, when we started, we were like, hey, everybody wants to be our friend. That's wonderful. Let's all collaborate on all these projects. And I have to say, the majority of them have been great successes, but others have taught me to be a little bit more discerning about which projects you launch into. I think this is my last slide. Yeah, these next steps are just some of the thoughts that I was so excited to hear about the African Fetal Medicine Network. And within the African Neonatal Association, we have associate members. So to be a member, because we are snobby exclusive folk, we say, well, you have to be a neonatologist or a pediatrician, but we have associate members, and those can be people. So if Dr. Varenga says, I would really like to be participating in whatever, great, come on board. You can be an associate member. Basically, you're a full-on member, but you don't get to vote at our biannual general meetings. And we did that because we still want to retain a degree of control over the organization, but also organizations can join. So if the African Fetal Medicine Network wanted to join, we would be delighted to have you as members. Something that we've learned is important are memorandums of understanding. And the simpler, the better. I could write one between our two organizations in 10 minutes just to say, we're both interested in the well-being of African women's families, fetuses and newborns, and we want to work together to achieve that end. Basically, they have no legal standing, but they're just saying, guys, we'd like to work together. Something that we have that you might be interested in is that we have a very good continental reach. We are in almost every African country, including non-English speaking ones, and our members are involved in the care of neonates, and they tend to know like who are the active people doing fetal medicine or doing obstetrics or doing nutrition in those countries. So we would be very happy if you wanted to try and reach out to your colleagues in countries where you don't have members. We have, this is something Dr. Varenga and I have been discussing individually, but I think it's better discussed continentally or even globally. We are aligning neonatal databases, but there's a lot of area for cooperation and aligning with fetal medicine databases. I've talked about the African perinatal umbrella. That's something that we would like to contribute to over the next 2 years. And please consider publishing in our journal. And that's it. I apologize for the very dull nature of my slides. My computer broke, and I had to do this on someone else's computer where I didn't have any graphics at short notice. But I think you got the message, which is basically thank you so much for the work you're doing, and we fully support your expansion to an African organization, and it's so timely and needed, and I'm sure you will experience great success.